The final method of communication we will cover this year is called oralism or the oral method. Again, the name conveys what the focus of the method is. Oralism is when a deaf person learns how to speak and read lips. Before we discuss this further, it is important to note not all deaf people have experience in oralism, and even those who do may not be skilled in it. Do not assume a deaf person can speak and read lips. If they can, do not assume you will be intelligible to them. Speaking is difficult for deaf people to learn. For hearing people it is straightforward. As an infant you are taking in the sounds and speaking patterns of the language, the brain slowly begins to process the information, and eventually, the infant will try to speak. After a few years, the toddler will do a good job at being able to produce words and create their own sentences. However, the most important part of this process was the baby being able to hear. When the baby cannot hear, they are not able to identify the sounds of the language, and when they begin to produce sounds, they are not able to self-monitor to see if the sound they are producing matches the appropriate sound they are aiming for. Therefore, a deaf person learning how to speak is a lengthy process. It typically requires years of speech therapy and various methods to teach them how to speak. We need to remember they need to learn the concept of sound. If they were born deaf, they are unaware of the sense. Then they need to learn the different parts of speech that exist in their language, the phonemes. This would be concepts such as the K or SH sounds. Then the hard part, teaching them how to produce those sounds without being able to hear what they sound like. This often involves a lot of touching and feeling the throat and mouth of the person teaching them, then touching themselves and trying to mimic them. This repetitive process takes time and does not guarantee understandability. Just as it is difficult to learn how to speak, learning how to read lips is hard. First, we need to remember not all sounds look different. For example, the difference between ba and pa. They are still produced in the same location, bilabial, meaning the sound is formed by closure or near closure of the lips. In addition, they are both produced in the same manner of articulation, stop, or sounds that require the speaker to obstruct the airstream. The only difference is the B sound requires the vocal tract to activate and make a sound, whereas P does not. So a person reading a person's lips would have a difficult time seeing the difference between ba and pa because the difference is sound. Let's move on to words. The words mom and Bob may sound different, but they look similar. Similar to B and P, the M sound is also bilabial. When making the sounds alone, /m/ is typically drawn out and the mouth stays closed. However, in a word such as mom, the mouth is going to open for the O sound before shutting again for the second M sound. So what you have in these two words are lips closed, lips open, lips closed. Put the word into a sentence and the mouth is already moving to the next sound in less than a second. So in a sentence such as, then mom went to the store, the word mom could easily look like then Bob went to the store. Lip reading depends on context. Similarly in ASL, when a person fingerspells, you are not looking for each letter, you are using the context of the situation to help you understand the word fingerspelled. This is what deaf people do when they are lip reading. They are using the context of the conversation to aid them in understanding. However, what happens when they do not know the context? What happens if you turned your face away from the deaf person at any point? What happens if the person has a beard or mustache that covers part or all of their lips? What happens when the person is wearing a mask for their health or the health of others? Lip reading is not easy. Several factors make it difficult for deaf people. If you want to try lip reading yourself, then turn off the sound and captions on a show and try to read the actor's lips. Do not assume the deaf person you meet speaks and reads lips. If they do, do not assume their speech and lip reading skills are the same as other deaf people.